Let's study neural tube defects in 3 minutes. Previously, we have gone over the process of neurulation. At 2 weeks, a primitive streak appears in the bilaminar germ disc, resulting in ectoderm, endoderm, and mesoderm formation. At 3 weeks, the notochord appears, causing the ectoderm to convert into a neural plate. The neural plate converts into neural folds, which turn into neural tube and neural crest cells. This is called neurulation. At 4 weeks, the anterior and posterior neuropores fuse, resulting in the formation of primary brain vesicles. If that does not happen, at 4th week or 28th day, it results in a persistent continuity between the spinal canal and the amniotic cavity. These are called neural tube defects. It is also called spina bifida, which literally means split spine, as the spinous process of the thoracic vertebra usually disappears, resulting in the protrusion of spinal canal contents. Etiology includes genetic factors like a familial disposition to neural tube defects, folic acid deficiency, especially low folic acid intake during pregnancy, teratogenic agents like medications and toxins including valproate, methotrexate, and isotretinoin. Conditions like obesity and diabetes also elevate the risk during pregnancy. Some ethnic groups also have a predisposition to NTD prevalence. Let's start with spina bifida occulta. As you can see from the lateral image and the cross-section, that this defect is caused by a failure of the posterior neuropore to close, resulting in a bony defect. There is no herniation of the spinal cord or the meninges. It is associated with a tuft of hair and a skin dimple. Next, we have the meningocele. In the meningocele, there is a failure of the posterior or caudal neuropore to close, resulting in a bony defect. In this case, only the meninges herniate. It is associated with skin thinning and Arnold-Chiari-2 malformation. Next is the meningomyelocele, which is a defect due to the failure of the caudal neuropore to close. This results in herniation of the meninges and spinal cord. There is thin or absent skin, and it is associated with Arnold-Chiari-2 malformation and syringomyelia. Then we have myeloschisis or rachis. This is due to the failure of the posterior neuropore to close, resulting in the herniation of neural contents without any skin covering. Next, we have anencephaly, which is due to the failure of the anterior neuropore to close. This causes an open calvarium with no forebrain. It is associated with polyhydramnios. Investigations include a maternal serum alpha protein level, which increases in the amniotic fluid and serum, prenatal ultrasound, acetylcholine esterase, which also increases, along with postnatal imaging. Symptoms vary by type, starting from usually no symptoms to mild neurologic deficits up to paralysis, bladder bowel issues, and orthopedic problems. Treatment includes surgery, often shortly after birth, physical therapy, occupational therapy, and supportive care. Prognosis varies widely, and many individuals can lead healthy lives with proper treatment, while others may face lifelong disabilities. Folic acid supplementation before and during early pregnancy significantly reduces their risk. I hope that was helpful. Stay tuned for more. Bye.